That's right. All right. Maybe you've gone to the emergency room for something minor, like a cut or a sprain, or maybe running a fever.
Chances are you waited a pretty long time to be seen and treated. CBS2's Dr. Max Gomez tells us about how one hospital is getting telemedicine to make those ER visits faster and also less stressful.
That's right. Exactly. It really is. You know, in most ERs, anywhere from a third to a half of all patients aren't real emergencies. A sprained ankle isn't life-threatening. You still need to see a doctor, but they're busy seeing heart attacks, strokes, and major trauma, so you're going to wait. But maybe not at New York Presbyterian. This is the image most people have of an emergency room. Lots of action, noise, and stress. What if an ER visit were more like this?
May I take a look at your ankle? Sure. Are you able to raise it up onto the table?
This is the express care service in the ER at New York Presbyterian-Weill Cornell Medical Center. Marianne Gallagher is recreating for us the ER visit she had just a few days earlier after she twisted her ankle gardening.
Okay, if you go all the way down to the foot, do you feel anything there?
The innovative use of telemedicine technology is the brainchild of emergency physician-in-chief Dr. Rahul Sharma. It's designed to ease waiting times and, more importantly, improve care for real emergencies.
Some of these non-emergent patients, our urgent care type patients, could take resources away from our more critical patients, our nurses, our doctors, our other staff members.
When a patient comes into the ER, they go through a standard triage and screening by a nurse practitioner or physician's assistant.
Okay, so it seems like you're tender right over the tendon.
If they're deemed a non-emergency, they're asked if they'd like to see a board-certified emergency medicine physician in a private room.
Immediately, I felt I was one-on-one with the physician. The screen was gone. I was able to feel her empathy and her caring.
But if at any point the patient is uncomfortable or the situation is more serious than originally thought, the main emergency room is right out the door. Dr. Alexis Halpern is one of several ER docs who can see patients at several sites and on a mobile app, all from one location via telemedicine. She feels in some ways it's actually better medicine.
We don't have all of the interruptions that we often get in an emergency department, whether it be other patients that need things, nurses who have questions, whatever it is. You know, we can focus directly on each other.
Now, the patient and doctor actually work together, taking a picture of their sore throat or pushing on tender areas. If a patient needs a blood test or an x-ray or another exam, there's staff there to help. In the year or so that this has been in effect, the average non-emergency visit time has gone from about 2.5 to 3 hours to under 40 minutes.
Why not?
That's significant.
And it's up to you. You don't have to go through it that way, but if it's not an emergency,
it's going to save me that much time.
Get out of there in a half an hour.
The pediatrician too for the kids, and
exactly.
You know?
Yeah, and you can even do it, and they can actually do it also via a mobile app if you happen to be out at the beach or something.
Mm-hmm.
Might even save you a trip all the way into the emergency room.
Right, we're about saving trips around here.
Yeah.
Thank you, Doctor.
You bet.
Thank you, Dr. Max.